I've had a very active life. I run marathons, I'm a long distance cyclist, I'm a chiropractor, so I'm always physically using my body. But then I ran into a situation where I was getting this pain in my left buttock, and it was running all the way down into my leg. And when I would sit down, that left leg would either start tingling or go numb. So I couldn't enjoy sitting in a restaurant. I couldn't watch a movie. If I took a long car ride or a plane ride, I'd have to find a way to stand up. I was always standing.
Mm-hmm. And what influenced your decision, to come to Sono Spine versus a traditional hospital-based spinal surgeon?
Well, first of all, being a chiropractor, I'm always looking for alternatives to the medical model. And with regard to patients I've had, there's always too much. They always recommend too much. In my case, the neurosurgeon in my network wanted me to get a spinal fusion. And I'm like, no, I don't want to do that, because that wasn't what was causing the problem. I also looked at laser, and that wouldn't address it either. What I've got is unique. And I wanted something that would remove the bone without causing any spinal instability. Mm-hmm. So the specific ultrasound technique that Sonospines used was acceptable to me.
Awesome. That is great. And what are you doing now in your life that you were unable to, prior to the surgery?
Well, I'm enjoying life again. Mm-hmm. I can sit as long as I want. I don't have to get up. Long rides, all that is much better. I'm not taking any ibuprofen anymore because that was damaging my kidneys. So other than that, I'm drug free and I'm fully active. I didn't even have to undergo rehab.
That's awesome.
Yeah.
That's really great.
The next day, I want to express, day after surgery, mm-hmm. Okay, we went out to lunch and then I walked 2.5 miles.
Wow.
The next day. So I was impressed.
That is incredible. And last question for you. So what was your experience with your patient care manager and having, someone to help you through the process?
Well, I'd say it was really good. And she held my hand every step of the way to make sure I got the consultation, make sure I had other procedures done in order to provide medical necessity. And she did everything except schedule my mm-hmm. surgery. Mm-hmm. That was handled by someone else. Mm-hmm. So, she did a great job. Perfect. And she held my hand.
That's great. And I actually have a surprise for you. So let me take out my headset.
Okay. Can you hear me?
Yeah.
Okay, perfect. So I actually have someone that wants to come say hi to you and meet you.
Oh,
hi, it's Meredith, your patient.
All right, there you go. Hi.
Yeah, finally get to see you face to face after almost 2 years.
Yeah, and I'm smiling again, so that's good.
Yeah, exactly. I guess it's been a year out since your surgery, but we were talking for a little bit, so.
Oh, it was like February prior to that, at least.
Yeah. So, I wanted to say hi. I always appreciate, getting to hear from patients that are doing so well post-op, and wanted to say hello and how much we really appreciated you.
Well, my pleasure. And I'm doing my best to refer people for that as alternative.
Yeah.
But I tell you what, I'm sold. So, yeah, it worked, and I can do what I want. What am I doing? I got 60 miles. I did 30 yesterday, but I'm working up to 60 miles. I have an elliptigo. You ever see those things?
Oh my gosh.
You know what I'm talking about?
Yeah.
It's a stand-up bike.
Yeah.
You ride outside, yeah. So I had to do that because I couldn't sit down on a bicycle.
Oh my gosh, I remember talking to you about that. Well,
yeah, but I love it now. So the heavy bike.
Well, I just wanted to say hi. I'll let you get back with Sarah Kate, but if you ever need anything, you can call me, and we're always happy to hear, about positive outcomes from patients like you.
Yeah.
So the only place to get surgery right now is either where? In Oklahoma City or Phoenix?
And Dallas.
And Dallas.
Yes.
All right. Okay. I'm on the West Coast. I have to convince people to take a nice trip.
Free virtual consults before they ever have to travel.
Oh, I know that. You know that. Right. So just do the consult.
Yeah,
Yes.
free MRI review and then
Yes.
virtual consults. So, we'll verify the benefits before we schedule the consult or anything.
Yeah.
But,
I enjoyed, Dr. Connolly was great, over at Direct Orthopedics. So I thanked him right away. I called their office first.
Amazing.
Yeah.
Good.
So,
Good. Well, it was so good seeing you, and I wanted to say hi, and I'll let you get back to it if there's any other questions Miss Sarah Kate has for you. But, if you ever need anything, let me know.
yeah, sure. The thing I liked about you, Meredith, you really helped to get the medical necessity handled.
Yes.
Yeah.
Yeah.
That's basically what it comes down to. You can do whatever you want, but
That's what we're doing.
all right.
Yes.
Okay, so I'm still working. I'm probably good for another 10 years now. I'm working.
Amazing.
Of course. Well, that's the goal, long-term relief.
Yes.
So,
Absolutely.
And function and not lose my function. Right. That's important. All right, well, I'll talk to you later, Meredith.
All right. I'll
Send
let
an-
you back
I'll
to
send
with
an-
Sarah Kate.
All right,
Bye.
good.
Yay.
That was a nice treat.
I know. It's so fun because, we talk to patients all day, every day, just on the phone. So it's completely, a different experience to, but if you're ready to wrap up, I think that was great. Are there any other questions that you want to go over?
Really? The only thing I can tell you is that, like I said, laser surgery is pretty much not much. And even with me looking at it, I thought that's not my problem. I don't have an acute bulging disc. My case was complicated. And that, I have a spondylolisthesis. And the whole thing with that was, making sure that it would remain stable, by taking enough bone out. And I knew exactly, only because I've been in a profession for 36 years, that I know, I'm very reluctant on surgery, and then having me to have to do it. Because I knew chiropractic wasn't working anymore for me. It served its purpose, but,
So what would you say to patients that are on our website? So this video will likely be, under patient stories. So what would you tell patients that are, just researching and wanting to take the next step with Sono Spine?
All right, investigating Sono Spine ultrasound surgery is part of anyone's research. A lot of people don't know it's out there, but it's there and it works really well. And you have to take it into consideration. It'll get you the best results with the minimal amount of side effects. So definitely worth looking at compared to others. And I think it far surpasses everything else that's out there.